Everyone, we'll give it just a minute or two for people to log in, but again, this is going to be recorded, so we will distribute this video at the end of the presentation. For those of you who don't know, my name is Cam Ayala, and I'm a lymphedema patient as well as an advocate, and I'm your local compression therapy consultant with Medical Solutions, the provider of LymphePress, and I'm the co-founder of LympheHeroes Houston. So this is our second ever meeting, and again, apologies for some of the technical difficulties at the beginning. Again, more the reason why we're anxiously awaiting the time where we can all meet in person at least once a quarter. So I'm now going to turn it over real quick to the co-founder, Sophie Long, and then we'll get started with the speakers.
Hi, everybody. For those that don't know me, my name is Sophie. I work at Women's Health Boutique and Second Silhouette. Everyone should be pretty familiar with us and our process, but everything that John is going to talk about from Sigvaris are all products that are we are able to order, dispense, measure for, and all of that. So if there is something that you guys are interested in or see something particular for your patient, we can definitely help you guys with that. Like Cam said, I'm one of the co-founders of LympheHeroes, and we can't thank you guys enough for joining us virtually. We hope in the near future that we can all get together in person. But you know, we're going with the flow. We'll save questions at the end. Again, this is recorded, so we will send out a link for those therapists that weren't able to make it or want to utilize this as a reference point for anything discussed. Again, thank you guys for coming on. And John and Pam, I will turn it to you guys to introduce yourselves.
Awesome. Hey, so Pam, you're muted, so I'll start here. My name is John Hoffman. Thank you so much, Sophie, for asking me to come on. I apologize, my mail's a little slow here to Michigan, so I didn't get my fantastic shirt, but I'm looking forward to that as well. I'm a product specialist at Sigvaris, and I focus on our complex products. And then Pam, if you want to introduce yourself.
Hi, everybody. I'm Pam Cunningham. I'm the local Sigvaris territory rep for Houston and surrounding areas. Thanks so much for being on today. And thanks, John, for being willing to come on and share a lot of really cool lymphedema products with us. So I'll mute so you can take it away.
All right, excellent. So I wanted to talk about a couple of different products, including kind of highlight a new product, but I really wanted to speak to a lot of the soft tissue work that we're going to be hearing about from Emilia here in a little bit. So I thought it would be maybe apropos to talk about how some garments utilize different materials to aid in soft tissue movement. So kind of have it from the therapist side, and then from a manufacturing side, you can see how both a garment and therapy can work together. So just as the kind of set a basis, and they kind of always have to talk about it, but I wanted to quick highlight our ComproFlex wrap. If you have not seen this before, this is just a simple breathaprine or like neoprene style short stretch type of wrap that I think most people are familiar with some of the different brands. And this is a really great product that reaches across a lot of disease states, wound care, lymphedema. But what a normal wrap does not have is any type of foam or any type of therapeutic device to work with the actual material. We just are really forming a shell. So this is going to give you some compression, but it's also going to give you containment, which is really important for our lymphedema patients, is that containment factor. So that's what this material is capable of, is providing that shell, but we don't really have anything with a wrap that's going to work on the skin. So with that kind of in mind, this is a great go-to product, or some of the wraps that you may use may be a really great go-to product. But what about those patients that need some of that soft tissue work and something that maybe you're working on your patient in therapy, and you want to suggest a garment and kind of understand how they even work? So I'm referencing obviously Sigvaris garments because I work here, but a lot of the garments are, some of them do have similar ones, so you may recognize some of the other names that are kind of similar type products. So I want to start with a real simple one. This is called our chip sleeve. So this product here is similar to a Tribute if you're, or a Jovipac, kind of depending on what area of the country you are. And I got this little oversleeve here. Let me remove that. So what we have here is a chipped foam material. And what chipped foam does is you can actually kind of see here on the camera even how you have all these different lumps and bumps. It provides different and variable pressure. So the foam has a little bit of give to it. And as you move throughout the day, and as there is pressure from this oversleeve going to be applied, it's going to slowly work on that soft tissue and kind of help soften fibrosis. So this is something that, especially in the upper extremity, is a very popular nighttime garment post-mastectomy, especially when you're developing some fibrotic tissue from that. If you've had maybe some biopsy on the bicep and things like that. And so this is kind of a great piece to work on some of that fibrotic tissue. It does have limitations, just like the Tribute as well. It is less of that container. You can kind of see it's very, very stretchy. So this is something that is providing the therapy, or it's assisting with that soft tissue breakdown, but it doesn't have as firm of that outside shell. So I think a lot of us, especially myself, can relate to this during the pandemic. I had to go to a funeral this week and wore button pants. And those were very containing. And right now I'm wearing sweatpants, and those are a lot less containing and a lot more comfortable. This is kind of in the sweatpants family, and something like the Compraflex, or maybe one of the other products we're going to talk about, have that containment like the button pants, where you're not giving that fluid any option to go out. It's just going to go up. So there are limitations. This is a mild to moderate garment, but we're trying to essentially achieve some of that same light, shallow skin movement and massage that you get from MLD. You can also see it's got high and low points, so hills and valleys. And so this is creating a pressure point. So more pressure is getting pushed in this area because it's puffier. And then these channels really give an area for there to create a channel on the surface of the skin and really move and evacuate that fluid. And those kind of go medial to lateral, just kind of generally in the same direction that the body wants to push it anyway. For you, a really interesting point is these are available from Sigvaris as an off-the-shelf option, which you can't get with the traditional Tribute wrap. And so we found that due to the flexibility of this material, most patients that don't need the containment, more containment, are going to fit in the size ranges that we have. And so because it's off the shelf, it's a little more cost effective. Generally maybe 30 to 50% less because you're not doing a custom. It's also pretty cool because it's a sleeve, a 10 to 15 sleeve, and then it comes with an oversleeve. So this is what's really going to be applying that compression, and we've layered it. So we know from stockings, and maybe Pam can tell you from stockings, if you have a patient that can't wear a 30 to 40, you can put two 15 to 20s on them and layer that and build that compression just to make donning easier. That's essentially what we're doing with our oversleeve. It gives you the ability to use this as a bandage liner, or gives you the ability to use it as a fully self-use garment. And this will put you in the 15 to 25 range. So kind of a nice moderate, and one oversleeve is included. And then if needed, you can actually buy another oversleeve, and we have some delightful shades and colors, such as this. But this can get you into the 25 to 35 range. So it gives you the ability to look at your patient's condition, and if they're having, maybe a little bit more reflux issues, and it's not, the one oversleeve is not containing enough for them, there is an option to give it a little bit more, or to reduce that, or to use it wrapping with bandages as need be as just a foam liner. So very versatile product, but kind of touching on that affecting the skin and how the garment works. We have kind of a next stage of garment where we have a better container. So this is our Metaform, and it has a very firm containment shell on the outside. So this is something that's going to be for that moderate to severe patient, because we really have a firm containment unit. But what we've done, I want to kind of draw attention to on the inside, is this foam layer. So this is not a chipped foam, but it is a cut wave foam. So I call this like a Ruffles potato chip foam. It looks just like that, where it's got the same high and low points. It's a little hard to see, but you can kind of catch the edge of those ridges there. So all of our products that do include foam, besides maybe one, I think we have one wrap with a flat foam, but for the most part, we use this wave foam, and it's to, again, stimulate those high and low pressure points. The foam has not as much randomness to it like the chip foam, but you get that crush movement and that kind of gentle massage, and then the higher pressure from those ridges, and then those low points, which will create kind of scannels real superficially right below the skin surface to help move that fluid. I'm not going to spend too much time on this, but it does have a lot of options for kind of setting the garment exactly how your patient needs it. A lot of options for tightening and cinching these and going around kind of the elbows and those difficult spots. Replaceable straps, replaceable internals. So this is a product that if a patient is looking for a long-term care garment, this is a really great option, really great containment for nighttime, and going to work the skin a little bit as well. We have another product that's shifting gears just slightly, but kind of thinking about these patients that you may be interested in. So this is a custom piece. So we do custom and we do off the shelf, but I actually have a sample here of one of our vests. So this is a unilateral application with the foam, but we've essentially done the same thing here. I'm going to fold it in half so we can see the side with the foam, where we've used that same chip foam. We have these same channels here, and this is designed extra long waist. So for those patients where a normal bra is not going to be enough post mastectomy, maybe a rare male breast case, a breast cancer case, a vest rather than a bra, would probably be a little more comfortable myself wearing that. Unilateral, bilateral application really fit custom for that patient, but this is going to give you kind of that full truncal compression. Maybe pair it with like a pair of our shorts, but you can get the chipped foam where you need it. And again, that's exactly like our chip sleeve. It's incredibly soft, and it's quite effective with that breaking down of the fibrotic tissue with that randomly chipped foam. So we have options for arms and legs with our traditional chip sleeve. And then we have some custom options and some, all of our chipped like pads, like swell spot type of things are all made out of this same material and in a variety of different shapes. And those can be useful even like we have a groin piece. So you have a patient that has some testicular swelling or something post-cancer, and grab a pair of our shorts and stick one of those pads in there, and you can help keep that fluid moving and keeping it from getting fibrotic. Some of the circular kind of swell spots, again, kind of tuck them in as needed and give you a little bit extra compression and then that therapy of that chip foam. So the last thing I want to talk about is a combination of the two. And this is, I think, really exciting because it's a brand new product. We actually just soft launched it. So most of our reps haven't even seen this. We're training on it in a couple of weeks at our sales meeting. So I'm pretty new to this, but really interested in showing it to you. And honestly, as a company, we're all about feedback, and we were trying to design this product to fill a need. So if you're interested in seeing more, providing feedback, if it looks like something you might be interested in, you can reach out to Pam or myself, and we can get you hooked up with our product lead, and still kind of an ongoing process. But this is called the Chip Flow. And as you can kind of see from the first impressions, it looks like the Compraflex, and you'd be right. It's very similar. Basically, our Chip Flow is if this product here and this product here had a baby, and we created an external breathe-a-preen shell, so you get the containment, which is typically lacking in a chip foam material. You just don't have very much containment. So the Compraflex material is going to give you that containment, but then underneath it all, you have this wonderful chip sleeve. So we do have, it's a slightly smaller chip channel. What we found is that the larger chip channel generally is more effective. But since this has multiple layers and you have this rather firm external shell, you're getting more compression out of it. So it kind of negates the fact that the bigger ones generally give you a little bit more pressure. But since there's external pressure, it's not an issue here. And it allows it to be a little bit thinner. It has an attached foot piece, and there's kind of a unique ankle panel here. So this is a stretch panel that we typically find in a lot of our wraps that are like a donning assistive. So it has a place to hold onto the patient's leg so that they're not trying to, need three hands to apply a garment. But it also doubles as extra compression right through the ankle zone. And this is kind of just an adjustable sleeve that you can slide up or down. Again, that attached foot piece. So I have this displayed on a calf right here. But from our therapist that works with us, Red, and Eric, Red too, she was telling me that she thinks the most interesting thing from a therapy standpoint is the full leg. So we do have this product available as a full thigh garment in a single internal foam sleeve with custom Compraflex components designed to fit exactly to your patient. So this is a custom product. So some of you, it kind of varies by region and things like that. Some areas have really good coverage for custom lymphedema products, especially like tributes and things like that. And some may not. So kind of take that as needed, but generally we're thinking about this as being a custom product that a private insurance would hopefully be able to see some coverage with. But yeah, it's a really cool piece. We're combining both functions, and essentially all those patients that you may have put into our chip sleeve or a tribute or a chip foam device of some kind, and they just continue to push out or swell out, and they're not achieving the containment. They're getting therapy from the chip sleeve, but they're not getting the containment that you need. This is going to be a really great option. So there's more to this to come. Pam probably within a few weeks will have those print material, and we're going to learn here just the first week of February. So just really excited to launch that. And I think we're still probably looking for people that if you have a patient in mind, reach out to us, and we'll see if this is maybe a good product for that patient. But this is available, again, the calf and then the little entire leg, which I'm being told, again, is probably more of a unique design for the marketplace to have a one-piece internal calf sleeve, full leg with a little bit more flexibility. So really excited to show that. It does come with the boot real quick too, with gripper packs to the soles on the bottom. So you do have, whether that's a calf or the thigh, you will have that full range of coverage. So just a couple of things here about at Sigvaris, things that deal with moving skin tissue. So you can think about this as you're dealing with your patients. Are there products out there that are going to benefit with my patient's conditioning and benefit what I'm doing in the office here and kind of extend that work and be more effective? And here's a few examples of ones that are going to work with you. So thank you very much. I really appreciate the time and look forward to hopefully speaking to a few of you at some point. My information, I'm sure, can be grabbed from anyone in management on this meeting. So thank you very much.
Thanks, John. That was awesome. Really appreciate it.
No problem.
Great. And again, if you guys have questions, we'll save those for the end and we can circulate them around. So now it's my privilege to announce the next speaker. Her name is Miss Emilia Dewi. So Emilia, go ahead and take it away when you're ready.
All right. Hey, everyone. Okay, let me share my screen. You guys can hear me, right? Hopefully.
Yes, we
hear
can.
you loud and clear.
Okay, I've been having some technical issue with my new AirPods, so it doesn't work out. So now I still have my cables, but life is great. Slideshow, okay. I kind of put my introduction in part of my presentation, so there you go. All right, so today I'll be talking about the role of myofascial release treatment in lymphedema, just because it's something that's really dear to my heart, because when I first started as an OT who began this journey as a lymphedema therapist, I have no idea about myofascial release. So I'm really excited to share with you guys. Just a little bit about my background. I'm originally actually from Jakarta, Indonesia. So you may not know Indonesia, but you will know Bali. So we're part of the same country. It's beautiful, it's amazing. I miss it sometimes. But when I first moved here, I went to Arkansas for college in a small town of 11,000 people. And then I went to USC for graduate school in California for about 3.5 years. And then I moved to Dallas before I ended up in Houston. So I actually was introduced to lymphedema when I was a student in USC, because my clinical rotation was at USC Hospital. And 2 of my clinical instructors were actually lymphedema specialists. So I got to see firsthand how lymphedema can really be debilitating for the patients, and how therapists can really hands-on, like with the treatment, it was really effective and it was really beneficial for the patient. So I got really intrigued. It was really scary at first. But then when I moved to Houston, I actually joined Serum Memorial Hermann in 2012. And they started their lymphedema program December of 2012. So I became the second OT to get certified in lymphedema, and the rest is history. And just a little background about the patients that I typically see. I typically see patients who have lymphedema because of cancer. We do have some venous insufficiency, a lot of lipidemas, but we don't typically see a lot of patients who have stage 3 lymphedema in our clinic, because I'm at the satellite in Memorial City. Some of our other clinics see those patients more. So I'm not technically a specialist on those conditions. I always go to my go-to person whenever I have a question, who's also here, Missy Baylor. I'm calling you out. I love Missy. She's like on my cell phone all the time. So I kind of want to build a case, right? Why are we doing myofascial release? So like I said, when I first began my journey as a lymphedema therapist, I was quite overwhelmed and I just want to treat the lymphedema. So I was not really looking at the whole picture in 2013. I didn't realize that, you know, somebody with breast cancer actually have a lot of soft tissue restriction, and they also have cording. So I would like to apologize to my first patients because I did not treat their cording. But the more I see patients, the more I realize that when I treat their fascia restriction, their scar tissue, their cording in conjunction with the lymphedema actually improves more and faster. So again, why the myofascial release piece? Secondary lymphedema affects 1 in 1,000 Americans, right? I mean, I think everybody knows this. And they develop due to damage and dysfunction of the lymphatic system. And then we also know that as a part of that secondary lymphedema, the incidence of lymphedema is widely studied in the oncology population. So for example, like these are the patients that I'm seeing, head and neck population, more than 90% of them experience some form of lymphedema. Over half of those experience fibrosis. That's because of the radiation that has to happen in such a small area. And then 1 in 5 patients who have breast cancer will develop lymphedema. And some studies actually show that if you have nodes removal and radiation and chemotherapy, the risk is actually more than 30%. 37% of women treated for gynecological cancer experience lymphedema. So that's also a huge number. But what's in common with all these patients are most of them have scar tissue or fibrosis from their surgeries and radiation from the cancer surgery. Now, starting about last year, I start kind of diving into this path of abdominal surgeries because I start seeing that, hey, there's a connection between the swelling in abdominal areas with the swelling in the legs and the rest of the body. So I have seen it because, when you do your lymphedema evaluation, you would ask your patient, what is your previous medical history? And I would see that, patient has gallbladder removal, kidney removal, hysterectomy. Those are quite common. C-sections. I just didn't realize the connection, how that surgery can actually impair the lymphatic system. I knew it probably from lymphedema training, but I didn't realize that the lymphatic nodes in your stomach is actually about 1/3 of your whole body, including one of the most important lymphatic organ, cisterna chyli. It kind of sits right here, just underneath your where your rib cage meet or your diaphragm meets. So these are just some statistics about the amount of abdominal surgeries that happen in the US. So in 2017, about 228,000 bariatric procedures, and then C-sections. I've met so many people who have multiple C-sections, right? And then there's 3,000 procedures for cholecystectomy. And these are not, this doesn't include the cancer-related surgeries, such as biopsies, removal of tumor, or plastic surgeries. So kind of get me thinking, what about the other types of orthopedic surgeries? What about the other types of traumatic injuries? Even in this month caseload of the patients that I have, I'm just gonna look at my list for cheat sheet. I have a patient who have a bone biopsy because of a benign tumor on her thigh bone. So she started having scar and swelling and numbness in her leg. And then I have another patient who have a tendon repairs and foot surgery, and she already have lymphedema as a baseline, as well as a really long medical history in her pelvis. So her leg is very swollen, pretty recent after surgery. And then what about amputation and scar tissue? I have another patient that I'm still seeing that she have scars all over her above knee amputee limb that is still remaining. And then I have another patient, the new one, who has SCI, spinal cord injury from a drunk driving incident. And he has had dependent edema for the last 4 years and developed pressure sores. So now he has lymphedema in both legs. And he also paralyzed from probably the C-spine and down. So, there are so many traumatic injuries and so many orthopedic surgeries that happen in our lives. And I think that impacts lymphedema, and lymphedema impacts that. So like we were talking earlier, so all those procedures leave scar tissue, right? Any kind of scar tissue that you have in your body is actually fascia restriction. So I don't know if you know this, but your belly button is actually the first scar that you have in your body. And according to traditional Chinese medicine, your fascia actually starts in the belly. So make sure you work your belly button and work on it whenever you shower, because it's part of your scar. It is widely suspected that scar tissue can cause lymphatic obstruction and fascia restriction. I stole that from Karen Ashford, who was the speaker from last time. So it can actually extend from the skin all the way down to the bones. It can obstruct lymphatic circulation, and it also can be further developed in combination with radiation. And I know if you're a therapist over here, you see it all the time. Somebody may have a scar because of their mastectomy or lumpectomy, and then you put radiation on top of that, and that scar tissue becomes harder. We don't talk about it enough. I think we talk about it a lot in the last NLN meeting, but I'm guessing like most of the people that I see who have lumpectomy and radiation, their breast becomes so swollen, and some of them becomes very fibrotic. I think I've met maybe 3 or 4 patients who's the top layer of the skin in their lateral or medial breast becomes so thick, it's almost like a leather. And they're like 6 months post radiation. So it's not even long term. So that's why we need to work on the scar tissue early on while it's still mobile and before it becomes too adhesed to the tissue. And there's some that are visible and some that are not visible, because if you think about all the surgeries and the scar tissue that happen with hysterectomy, I have a couple of friends who have had a hysterectomy, and we can, I mean, when we work, me and another PT work on this friend, and we can feel the fascia restriction all the way down, like in her stomach. So, and she had a minor 5 little scars, laser procedure for her hysterectomy, but it impacts her lymphatic system, because occasionally she would tell me that she feels swelling in that genital region. So again, a lot of scar tissues that we don't talk about and we don't treat. And fibrosis. These are probably the ones that, you know, we talk about all the time. And like this gentleman here, these are not, definitely not my patient picture. I stole it online and I have a source for it. But that's the kind of neck that we see all the time, right, in clinic, because soft tissue fibrosis is associated with, with lymphatic impairments. So the study that I quote here is actually from rat studies, and they found that radiation is associated with severe long-term lymphatic dysfunction, so it may not be right away. And then they also decrease the number of dermal capillary lymphatic vessels. And then another potential mechanism by which radiation therapy can decrease lymphatic function is soft tissue fibrosis. And then I thought this study was interesting, also from a rat model, but they show that the lymphatic vessels that undergo fibrosis after a lymphadenectomy losing compliance, and in many instances become completely stenose and non-functional. So I found that to be interesting, because I remember one of the theories, or one of the explanation why axillary cording happen is because the lymphatic vessels becomes more stenose from removal of lymph nodes, and also because of radiation. So, and then of course cording. In a study of 36 people, they suggest that there's 50% of prevalence of cording with women with breast cancer. And another study find that 31% prevalence among 1,100 women. So in this study, they also find that patients who reported cording has 2.4 times the odds of developing breast cancer-related lymphedema compared to those who did not. So again, this is the importance of, doing treatment early, because Linda Kohler did another study, and they showed that physical therapy, which consists of manual therapy, exercise education, and other rehabilitation modalities, it improved range of motion, decreased pain. So we talk about cording, we talk about scar tissue, we talk about fibrosis. Those are can be very debilitating on a patient's function, because number one, it can be very painful. Number two, it can cause a swelling. And number three, with that, it can cause them to not able to participate in daily activities as much. So if you're looking at an arm, they may not be able to reach their arm. They may not be able to dress themselves because they can't reach the back of their sweater, right? Or if you're a woman, the back of your bra, that's a huge thing. And then for the neck part, it's very interesting, because the, radiation fibrosis and the adhesion in the neck can cause you, number one, to lose your neck range of motion. So think about driving, you have to turn your neck. And some of my patients have 20 degrees of rotation for a long time and pain when they move, right? And then if you think about swallowing, all the structures that have to be included when you swallow, I'm not a speech therapist, so I can't name a lot of them right now, but the radiation fibrosis can really impair your ability to swallow. I have a patient who haven't eaten for 2 years, and all of their goals are to be able to eat again, and they may not even be able to, because this adhesion that is in the inside is really difficult to treat. So again, it just kind of highlights the importance of treating the fascia restriction as soon as possible when it's still mobile. So next, I just want to talk about the tools that I use in my kind of clinical experience, and I just want to share it with you guys. And some of them you may already know, some of them you may not. So I'm happy to hear from others too. So I would like to hear what you guys are using in your clinic. So here are some contraindication and precaution on most manual therapy. I don't think this list is completely inclusive, but you can find it whenever you do the training. They will list all the precautions, but these are the main ones that I know. Active cancer site, on top of my head, infection, recent surgery, blood clots, risk for fracture, especially when they have osteoporosis after radiation and cancer treatment, wounds, skin irritation, and cuts. So I want to talk about Barnes MFR. In the therapy world, John Barnes is either considered a genius or somebody who's crazy, right? I think therapists either drawn to John Barnes or shy away from it. And I think if you're a therapist, I would like you to just consider him, just because I know there's a lot of like saying about his work outside of like, because there's no evidence and there's no, and he's a little crazy, which is kind of true because I think most geniuses are slightly crazy. But I find that his treatment is so effective with a lot of the patients. And if you're not familiar with John Barnes MFR, it's basically a hands-on technique that involves applying gentle, sustained pressure into the myofascial connective tissue restriction to eliminate pain and restore motion. So the time element is huge here because you want to do a low load pressure applied slowly to allow the fascia to elongate. So John really believed that, the fascia things that I'm going to discuss after is not as effective as what he does. And I think there's some truth to that because the reason why the time element is important, John also shares that he believes that a lot of your trauma, whether that be physical or emotional, is held in your fascia, right? So think about the last time you have a car accident and you're rear-ended, the trauma from that physical impact and also from just a trauma of like, I don't want to die, that all help in your body. So myofascial release, the way he approaches and the way he teaches is that you wait for the body to respond. You don't force it to just release because you want them to release, but the body has to be ready because it holds a protective mechanism around that trauma that happens to you. So he also shares that, myofascial restriction can actually cause a tensile pressure of 2,000 pounds per square inch on pain in the sensitive structure. So the pro is that it's very effective. It goes over, it's very holistic. So it looks at the body as a whole because I don't know if you know this, but, your cranium and your sacral, there's a connection there, the dura tube. And when you have an impact and fall on your butt, for example, it can cause you to have jaw tightness. It's been talked about in many different manual therapist circles, not just John Barnes. So like always look at the pelvis, even when you're treating the neck. Then let me see if I forgot anything else. And then also like especially for the head and neck region, because there's so much tension that you're kind of like carrying there, with the TMJ joint and, from the radiation patient standpoint, right? And then the stress that comes from the neck. Most people have chronic neck issues, I'm included. This technique is very gentle, it's very effective. And I feel like I'm not as, because in the neck area, you have to be careful, but with myofascial release, I just feel like because you wait for the body to respond, it's generally not as invasive as some other techniques. So that's why I like the John Barnes method. Anyway, he's still doing courses. So if you're interested, I'll give you some information of my favorite courses, but I think it's amazing. The second thing that I have really found to be useful for myofascial release is low-level laser or red light therapy. So there's different classes of lasers. So class 4 is going to be a little bit, has heat, a little bit more invasive. So you have to move it around just like ultrasound. The one that I have tried are cold laser class 3B. So Rian Corp from Australia, they have done a lot of study with lymphedema. And there is a company called ML830. They're actually based in Sugar Land, Texas. And the reason why it's 830 because they use the frequency of 830. So research actually has shown some evidence in effectiveness using low-level laser to manage trigger points and reduce pain. They're comparing that to dry needle, and they found that it's almost as effective. So dry needle can be more invasive, but I find that low-level laser is not as invasive. So it can be used effectively in wound healing, trigger points management, scar management, carpal tunnel syndrome, and many more. But the downside is that it's only moderate strength evidence, or not, like very minimal evidence right now, because there's not a lot of research being done. But there's a lot of case studies and a lot of patient accounts that you can find if you that this helps. So the idea behind red light therapy, and I'm actually a user myself because I have a couple of red light panels at home. I have a laser. It basically improves the mitochondria production because of that light. We don't get as much light nowadays. and it helps with cell repairs. And because of that, it also reduces inflammation. So this is really great for, again, those trigger points or fibrotic area, the scar tissue. Yes. So there's a lot of pros. The cons is that you need some training with this. And then also, depending on the class of laser, it can be more invasive. And the final cons is that it's very expensive. I think the one, Rian Corp is about $4,000, I believe. ML830 is about the same price, $4,000 to $5,000. And then there are more expensive lasers, like up to the 14,000. So, and my other one that I like is myofascial cupping or decompression. I use 2 of them, so I'm gonna stop sharing for a second. But basically, the idea is that you want to create a vacuum in a small area, and it allows for increased circulation and reducing swelling and more mobility in the tissue. And more research is still needed. So I use mainly 2 things. So I use a sink plunger and a rock pot. So, okay, for the sink plunger, whenever I bring this out, my patient always jokes, like, have you used it in the toilet? Did you get it from the toilet? And I assure them, no, we bought this just for patient use. So plunger has actually been used for a long time by physical therapists to do a lot of soft tissue mobilization around the knee and around the thigh because it's pretty effective. I like these because you can literally pop this on for a few seconds and you can see, I don't know if you can see how much tissue restriction. It does leave a mark, but it doesn't last for a long time. So I use this to work with the shoulder, scapula, and as of yesterday, I used it on someone's stomach. So again, the spinal cord patient that I mentioned, he has no mobility from here down. So he has stomach swelling. It starts also in his thigh. So I still need to treat the thigh. We're not there yet. But I was thinking, what can he do by himself to start working? Because he can't really reach down to his leg because his shoulder is not strong. Luckily, he has full shoulder mobility, which is amazing. So I start using this plunger on his stomach because he has a lot of swelling. And I ask him to feel it there. And then we just use the plunger a little bit for a couple minutes. And then he can see that the soft tissue is actually moving. So I like to use this because it's considerably safer. You can't really mess this up unless you pull the plunger and it almost hit your eye, which has happened to me before. But it's generally safe, and I can teach my patient and caregiver safely to use this at home. And it's only $9.78 on Amazon. It has to be a rubber Cobra 304 plunger, so don't buy a plunger from Home Depot. It may not work. The other one that I like is rock pots because it's also made from silicone, kind of like rubbery style, and it's a little smaller. So you can put it in a small area like the wrist. You know, when they have like the swelling in the pad and it becomes a little bit tighter, this is great for that. You can feel a lot of input to your skin from the vacuuming, and then also fascia restriction. So releasing fascia restriction. And the cool thing about rock pots is because they create it to be this way. You can put it on and you can combine it with active range of motion, nerve glide, and as you're getting the vacuuming effect, you're doing passive release, passive range of motion on the tissue. So I love these. They are great. There's other cuppings that are available made with plastic, made with different kind of silicones, but I found that this is the easiest for me personally to work with. So, all right, going back to my screen. Instrument assist soft tissue mobilization. So there are a lot of literature to measure the effects, and it's still kind of emerging. But there is a small evidence in its ability to increase short-term joint range of motion. And there's many different forms, right? You see here, there's the rock blades, there's the Graston that's very popular. And then there's the hawk grip. And then there's one that made with stone, gua sha tools, or I think the one that I have is called Curve. And it's made with another kind of stone. So the precaution is when you use this, it can really impact the skin quickly, and it can cause that redness, erythema factor that we want to avoid. So you have to be really careful when you use this and make sure that you have the appropriate training before you start using it on a patient. But on the other side, it's really effective, like of working on those really fascia restriction, scars that is fully healed, not scar that is barely healing, as well as tight muscles. Okay. And the downside to this, again, the training, you have to do the training, and the cost of the actual tools is quite expensive. I think there are some on Amazon that are cheaper, but if you want the better quality stainless steel, like the rock plate goes for, I think, $350 or $400 if you get a discount from Rock Tape. And Graston is over, I think it's over 800, I can't remember. But I know clinicians who use it on fibrotic tissue, use it on muscle, and like especially when you have that fibrotic tissue in the ankle, I've heard clinicians use the ASIM tool there, and it works wonders. Okay, kinesiology tape. I love tape, and I think I tape most of my patients if they don't have any skin issue. The main effect of tape is tissue decompression, because it can mechanically decompress the skin and the underlying tissue to apply to, and also relieve pressure from the nerve ending, so then it can reduce your perceived pain. So it works double. And number 3, with a lot of our patients, they may have numbness, or they may have, their sensation is not back yet from the surgery. So Kinesio tape is great because it provides that proprioceptive input to your body part, whether that be an arm or that be a leg, and that is amazing. It can be used for scar management, swelling management, cording, and all that stuff. So for cording, if you haven't done this yet, what I have done is, for example, let me show you this picture here. I was given these tips by Jeanette Zucker, so it is legit and amazing. So see where the cordings are, right? What I was told to do is to cut a very small strip of cord, but it's as long as the cord itself. So it would probably be like 5 millimeter, like the width of the tape. And then you apply it proximally and go along the cords. When somebody has really sensitive and really tight cords that limits their range of motion, you'll be surprised how much putting the tape can really impact their function. I have this patient once, I'm not kidding, because my jaw dropped when I see it. I think she had cording in her axilla. Her abduction was about 100 degrees probably before I do the cording. So I applied a cording, didn't do anything else. And then I asked her again to do shoulder abduction in sitting. So it's above against gravity. And she got all the way to 125 or slightly more. So it was like a 30-degree difference just applying tape. So if you never try it, try it. And thanks Jeanette Zucker for that. Okay. Finally, other tools for self-MFR, because as we know, it's important to do it daily and for self-care, because the scar, I think scar is a beast. You can make it softer, but then another trauma happened and it come back. I mean, it happens with cording all the time. Like you think that you have managed the cording well and the range of motion is getting better, and then they have radiation, and before you know it, the cording comes back. So foam roller can be used safely in different areas that are larger. Soft therapy ball, vibration therapy with different tools, probably not the really hard vibration, but the softer vibration is better. Dysum, I use Dysum all the time. It's like a sticky pad that rehab therapists use to make sure that things don't slide from under them. So I would give my patient a small square, and they can use that for their scar. And also, even if they're doing self-MLD and some areas are a little thicker, I would give them the Dysum anyway. Or if you don't have Dysum, you can use rubber gloves also. Self-stretching, nerve glide exercise, and then compression. I'm stealing this from John because yes, compression is absolutely important for myofascial release. And, again, importance of daily routine, because we need to teach our patient that this is something that they have to do daily. So here are some of my case studies. I'm using the same case study from my last presentation, but with this lady, she has lumpectomy. No, she has mastectomy, and she had deep reconstruction. So she has a lot of tightness and scarring in the stomach, and she told me that it feels like my stomach is about to burst, even though I know it's not true. So with her, I combined myofascial release, some soft tissue mobilization work, and taping. And that's the result, and she felt a lot better. With this other gal, she has lipedema, and then also extensive abdominal surgery, including gastric bypass surgery, and then 2, I think, hernia repair. Nope. Yep. I can't remember the other 2. But anyway, when I start working with her, she has a lot of swelling in the stomach. So again, I'm combining MFR with soft tissue tools and then also laser to help her get where she needs to be. And then now she's using her LymphePens not very, very consistently. So yeah, we need to get to do that. Finally, just closing thoughts, right? So there is really no one way approach to do this, I believe. I think use anything that will work for the patients. All the tools that I'm sharing with you guys today, I use them all with different patients because it has to be client-centered. It has to be what worked for your patient, what they're going to do at home, and what their body needs, right? Because I mean, that's the whole thing about clinician is that we do trials and errors, and we become a detective who actually looking at the body, looking at the patient, and match their goals and match their symptoms with what we need to do to help them. So I like this picture because I want to tell you a final closing thought. Recently, I have my own health scare slightly. So I have had, like I said, chronic neck pain on and off because of text neck, because of doing a lot of lymphedema work, manual work, stress. I carry everything in my neck, right? So this picture is something that Dr. Perry Nicholson used to teach one of his classes. And I appreciate this because, you know, sometimes when we're looking at somebody who has lymphedema, you only look at the lymphedema, or maybe it's just me, but sometimes I just look at the lymphedema and I forgot that all those structures are connected. You have the nerves, you have the arteries, you have the veins, they're all running together. You have the fascia, the rib cage, the collarbone, everything is together, right? It's connected to your diaphragm, connected to your pelvis, connecting your abdominal. I mean, everything is connected. So I actually start to have tightness in my neck and fascia restriction throughout my pecs, right? At first, because my pecs was really hard. And I thought, what's going on? And then I start having presentation down to my bicep, all the way to my forearm. And then the next stage was my bicep and my tricep was really hard. It was taut, like some of my patients. And I was like, oh crap, I'm having lymphedema. And, you know, my director is an amazing orthophysical therapist, and I share with her some of my symptoms. And she told me, it sounds like you're having some nerve entrapments, possibly your median nerve and maybe your brachial plexus. So she worked with me in my neck using the ASTIM technique. She do some soft tissue work, nerve glides, and I'm not kidding. In 30 minutes, my bicep and my tricep almost return to normal. Like the swelling goes down quite a bit, and the tightness that I felt and the fascia restriction is gone. All that to say, I think there is more to the story that, you know, there's lymphedema and the swelling can cause pressure on the nerve and vice versa. The nerve entrapment can cause swelling to happen. So again, we have to look at the whole picture, look at the patient and use whatever we can to help them get where they want to go. So that is all for my presentation. Thank you so much.
Awesome. Thank you. Thank you so much, Emilia and John, for presenting. So we're going to wrap up here. We're going to be sending out everyone a follow-up survey that just has a couple of questions. And if you see these LympheHero t-shirts and you would like one, let Sophie or myself know which size you want so we can get you guys some of those. First round was compliments of our team sponsor of Sigvaris. So thanks again, Pam and John, for sponsoring this session. And if anybody has any ideas for our upcoming meeting, which is going to be in March, so Q2, so we'll be doing that, and we're going to be looking for speakers and sponsors. So thanks again for everyone taking the time, and apologies for the technical difficulties. Hope everyone has a great weekend, and as the shirts say, and as I love to say, just keep lymphing. You guys have a great weekend. Take care.
Thank you so much. You too.